This podcast is brought to you by Avocado Mattress. And if healthy, comfortable sleep matters to you, this is one organic brand worth knowing. That's because what you sleep on actually matters.
Most mattresses rely on synthetic foams and chemical materials that trap heat, break down over time, or off-gas. Avocado does it differently. Their mattresses are handcrafted with natural materials, organic latex, organic wool, and organic cotton, designed to be naturally cooling, incredibly supportive, and long-lasting. They're certified organic by GOTS and meet multiple non-toxic and safety certifications. Made for people who care about their health and the environment without sacrificing comfort. I love that Avocado proves you don't have to choose between comfortable, supportive sleep and your values. And now, during our Earth Month sale, you can get up to 15% off Avocado mattresses. Just go to avocadogreenmattress.com. Get up to 15% off at avocadogreenmattress.com. avocadogreenmattress.com.
The best clinicians are not the ones who never fail or never miss tubes. They're the ones who never stop learning. Welcome back to Rebel Mind, where we explore the habits, mindset, and strategies that make clinicians not only better providers, but healthier humans. I'm your host, Mark Ramsey. Today we're diving into one of the most influential concepts in performance science and medical education, mindset. Specifically, the difference between a growth and a fixed mindset, based on Carol Dweck's groundbreaking work. Joining me are two amazing colleagues, Dr. Kim Bombach, an emergency physician who completed a fellowship in medical education, and Dr. Frank Lodeserto, a dual-trained adult and pediatric intensivist who also serves as the internal medicine program director. Kim and Frank, thanks for being here.
It's a pleasure.
Thanks so much.
First, I want to preface this episode by saying that what we're talking about applies to everyone, whether you're a PGY1, a couple months into residency, or a seasoned attending with 15 years of experience. Listen closely to see how your perspective and perceptions can change. Let's start with the basics. Carol Dweck talked about two core mindsets, fixed and growth. Kim, can you break down for us in the context of medicine, starting with a fixed mindset?
Yeah, absolutely. So Carol Dweck is a psychologist who studies how people's beliefs about intelligence and their abilities, aka mindsets, shape their success. A fixed mindset is the belief that intelligence is static. You either have it or you don't. It's like talent. In medicine, that might sound like, I'm just bad at procedures when you miss one. It can lead to avoidance, like sticking to straightforward patients and letting others take the complex or sick ones, and a lot of imposter phenomenon, worrying that you'll be exposed as incompetent when you have that fixed mindset because you don't believe that you can improve.
Yeah, and this is in contrary to a growth mindset that's seeing the ability as something that can be developed with the effort of coaching and persistence. For example, struggling with central lines early doesn't mean you're always going to struggle. It just means you need that really specific coaching practice, feedback, repetition, which ultimately leads to experience.
Yeah, it's huge in residency training. I've seen a lot of residents who just shut down after a failed intubation because they view it as proof they're just not cut out for emergency medicine or critical care. But those with a growth mindset, as Mark alluded to, can really step back and say, okay, what can I tweak next time? That difference in framing often determines whether someone improves or avoids a challenge altogether, like Kim said. It's important to just recognize none of us live in just one mindset. And I'll give you some examples from my own. So growing up, I had a very fixed mindset when it came to academics and a very growth mindset when it came to sports. But sports were my passion. Rest my main sport. My dad would often put me against heavier kids, older kids. And if you can imagine, I was this middle school kid wrestling high school chess. I was really nervous and I'd lose quite a bit. But over time, that kind of convinced me. I saw the improvement happening. I was getting better and getting better. And to make a long story short, by the end of my high school career, I was actually the #1 wrestler in America at my weight class and went on to wrestle, collegially at Division I level. But at the same time, so I had this growth mind in sports, but I had this very fixed mindset when it came to academics. I just didn't see myself as a really good student. I felt my dad was pushing athletics because I would never make it in the academic world. I have a little shame in it. I would sometimes cheat on tests, copy homework. I just didn't think there was a real need for it. In fact, my junior year, it all came together and I really thought I wasn't a good student. It all proved it when I got a 790 on my SAT. Some people may have to rewind that and go 790. I got more in one section of my AT than their total score. But, my identity back then was a sports college. I hurt my shoulder to an end. So I had to apply this growth mindset to academics. And it wasn't pretty at first. I got C's. I stayed up late night in the library. But applying this growth mindset, what I saw is that I can get better at academics. Today I'm a quadruple board certified medicine, pediatrics, adult critical care, peds critical care, and I love to learn. And if you were to ask one of my middle school teachers, they probably would be shocked that I'm a doctor today. So you can do it. You can apply that growth mindset to any domain and be successful, but it takes time.
Frank, I really appreciate your vulnerability and you sharing that with us. You said something that really piqued my interest. You mentioned identity. When we have a fixed mindset, we have a really static view of what our identity is. And that can be really hard when you're entering residency or as you're entering a new hospital system, as a new attending. You think of the constraints, what you're good at and what you're not, and it can really be tied to identity.
Absolutely. One of the things I do when I come on service to get my learners in a growth mindset is I usually introduce myself as a PGY 19. And the whole point is that, hey, I'm right here. I got a little bit more experience than you, but I'm right next to you trying to learn and grow. You might be a PGY 1, 2, 3, but I'm right on that spectrum with you trying to learn and grow. So I think that maybe sets the tone for my identity as a continued learner.
Yeah, these are awesome points. I had an intern who, I want to say 2 months into residency, missed a tube, and I was calm, collected about it, didn't raise my voice, but the patient had a desaturation episode, became hypoxic. I had to take over, but I did not do it in a way to belittle her by any means. And immediately after the intubation, she was nowhere to be found. And the resident was crying that she had missed this tube. And I took her aside and we had a conversation about it. And it was because they had this expectation that we as attendings or as doctors don't ever miss tubes, ever. And removing those expectations, and it was nothing I did. It was just this belief in her mind, right? That identity that like, I'm now a doctor, I don't miss tubes, was something that had to be shattered. And it was something that had to be replaced with more of a growth mindset that was like, why did I miss this tube? How can I fix and do something better next time so that this doesn't happen and improve? And then by the time that same resident was a third year, they were instructing interns and we joked about it and laughed about it. And it was a completely different person. And that's because they've gone through now 3 years of having a different mindset that was more growth mindset, right? And so I think it's super important to pair it with identity, as you guys had mentioned.
Well, Mark, glad you found that intern to talk to her. I mean, a lot of faculty don't do that. I mean, so that could have really changed the trajectory of your career, as you said.
Yeah, totally. So speaking of residency and program direction, Frank, as a program director, tell our listeners a little bit, how does mindset play into, how are residents learning and responding to feedback specifically?
Yeah, feedback is where mindset really shows up most clearly. I also like to describe the difference between learners with fixed and growth mindset, specifically when it comes to feedback, but a few other areas, because it helps us to recognize ourselves. Someone with a fixed mindset, as you guys said already, but avoids challenges because they're afraid of those challenges might expose that they're not, I'm going to use the word smart. Carol Dweck calls that a sort of curse word in her book. Don't use the word smart or stupid, but basically expose that they're not smart enough. They try to protect their ego. It's really all about performance and self. So when a learner gets feedback, I think what they're hearing is you're not smart or you're not intelligent and you're not good. And I think they shut down. When I often give feedback to my learners, I like to start with, hey, this is really here to help you. I try to give them specific feedback. Now, I'll go back to sports here. I couldn't imagine if my coach just said general things like, Frank, you're doing great. What would that even mean? I really wanted specific feedback because I wanted to get better as a wrestler. I couldn't imagine this general, non-specific feedback. I had to know my coach had my best interests at heart, that he wanted to see me get better. And the same thing for my learners. I'm trying to emphasize, I just want you to get better. This isn't something you should look at to say you're not good enough. This is all a path to get better. So we got to give specific feedback to our learners. Someone with a fixed mindset will be in that position where they're just hearing, I'm not good enough. I'm not good enough. as opposed to someone with a growth mindset. They know that the path to get better is through feedback and getting specific feedback so they can improve their performance.
Frank, you made me think of the difference between pedagogy and andragogy. As we become adult learners, even at the med student level, everybody's looking for that gold star, right? And then you go to residency and it's like, all that matters is what happens to this human being. It's messy and difficult. There's not a clear indicator when you get a gold star. So I think that can be really tough because we're all kind of looking for that external validation. But now you have to be driven to achieve on your own and to fill in the holes in your knowledge and cultivate that growth mindset on your own for the first time.
Absolutely. Yeah, I think we have more parts here to record because this gets so much deeper here. I said that saying the word smart is a bad word, but often when you tell a kid that they're smart, they put themselves, or at least we're putting them on a pedestal where they hear, oh, I'm smart. Now I don't want to take challenges any longer. I don't want to try now because what if I fail? And what if then the people think I'm not? They've been put on this pedestal their whole life. These are some of the best students. These are straight A students, high
Yeah.
achievers. And now we're telling them they're not good enough at something, or at least that's what they're hearing. It really shuts them down and then they're not open to that feedback. But yeah, that was a great point.
Yeah. Oh, totally. Feedback is a topic near and dear to my heart, and both summative and formative. And the way I give feedback on shift is very particular. Residents who are listening to this and have worked with me usually love it because it's a combination of direct observation, right? Actually, like, not to be a creeper, but like writing things down about them on shift, like actual objective things that I've seen. And then I actually sit down with them at the end of the shift in person, face to face, and I actually go through everything I wrote down and then share it with them so there's full transparency. And oftentimes, like you mentioned, Frank, you see where the fixed mindset people really come to light, and you see where the growth mindset people really come to light. And so we will definitely have more episodes about feedback on Rebel Mind for sure. But speaking of Rebel in general, we love critically appraising evidence. And so, Kim, is there any literature that just supports how mindset impacts performance in general?
Yeah, absolutely there is. So back in 2007, Blackwell et al. Published a landmark study in child development, and they were looking at how middle school students' beliefs about intelligence affected their performance in math. And that was during this tough transition to seventh grade math. And I know you may be thinking, how does this relate to residency? But I think even these early childhood experiences can tell us a lot about mindset. So they followed 370 students and found that those who believed that intelligence was malleable, those that had a growth mindset, showed an upward trajectory in math grades over 2 years. By contrast, the students who had a fixed mindset, who believed that it was static, they showed a decline in performance during the same period. What's really striking is that just the belief that we can improve can have real effects on our achievements, even at the attending level, and how we think about problems. And do we see things as a threat or do we see things as a challenge? I definitely found this really interesting because I'm always navigating that threat challenge dichotomy and trying to push towards challenge on rough shifts too.
So, Kim, thank you for sharing that. And there's also a great study by Dweck and colleagues in 2016. They looked at 10th graders, actually 168,000 10th graders in Chile. They looked at socioeconomic status and they looked at whether they had a fixed or growth mindset. And what Dweck noticed is that kids who had even a lower socioeconomic status, who had a growth mindset, outperformed their counterparts at a higher socioeconomic status mindset. If they had a growth mindset, they can outperform in math and in language the higher socioeconomic status by having that growth mindset. So we see the power of a growth mindset, as you mentioned, Kim, and this study really showed it. And there's been several studies. If you read the book, she mentions a lot of different studies where if kids are taught the subject, great. But if they're taught that growth mindset as well, then they'll outperform their counterpart.
Yeah, and what we'll do is we'll include these two studies in the show notes. Obviously, we can't include all of Carol Dweck's studies, but that is why you should just go and read her book because it's amazing and life-changing. We'll definitely include them in the show notes so that you can reference them after this is published.
So, both of those studies show that having this growth mindset is really protective and it can help you be successful in your future career. But I do want to highlight that this isn't just about telling those middle schoolers or the resident you're working with, you should have a growth mindset now. And you really have to have the systemic support in place. A big part of this is actually cultivating a psychologically safe learning environment, which is a really important concept that I can nerd out about. But basically, there are all sorts of applications for psychological safety and why it's so important to cultivate that in the business world in terms of performance, in the aviation industry in terms of reducing errors, in medicine in terms of being able to speak up when you see something that could be an error. Basically, caring for patients in these complex environments, we need to be able to say when we don't know or when something might be wrong. And that might be really difficult to do because they're kind of strict hierarchies in medicine as well that can make it really difficult. So I just want to say this isn't like a toxic positivity thing, like just have a growth mindset. You have to actually build systems that support it, in a more concrete way, having a culture of inquiry at your institution. After we present a patient, maybe I play devil's advocate with you a little bit about why you want to discharge that patient and we talk about it. Or that simple patient with back pain, but what if they did have a fever? Or that patient with a cough, but what if they fail their walk of life? You can play these mental games and make it a curious place. Also, kind of like what you did, Mark, with that student, you can also be vulnerable with them and let them know that it's okay for them to be vulnerable. You can let them know it's okay to have strong emotion when you're taking care of patients, and here's how we're going to move forward. And I'd love to know both of your thoughts on this. I think there's a way to do this with tact where you don't really say, I don't know, but I don't know, or I don't know, and this is what I'm going to do. So you're still sort of engaged and active. But what are your thoughts?
Yeah, I often will say, I don't know yet, or I
Oh,
don't
that's a great
know.
one.
Usually the word yet comes to mind for me. I'm not good at that yet. I'm not ready for that yet. The other thing, just a quick go back to your point about creating a psychologically safe space. This is a huge topic that we will definitely dive deep into with later episodes, especially with a lot of the comparisons to aviation. That is something we could be doing a lot more of in the medicine world to reduce errors. They've had to get it down much faster than we have had to because of the sheer volume of flyers and the catastrophe that happens when they don't get it down. But yeah, my go-to word is usually yet, or I'm not sure and would like to learn more. My 5-year-old, I've instilled already in that whenever he says, I know, I catch him and I say, we don't say that. He says, grunts and goes, tell me more. And I say, yes, that's exactly what you should be saying instead of I know, because we don't know everything and we don't aim to know everything, but we are learning to learn as much as we can. And that's what our goal is in life.
Man, Mark,
My two
I didn't
cents.
know I was going to get some parenting advice here. This is
Yeah,
great stuff.
there you go. You're absolutely welcome.
Well, Kim, you talked about the power of Carol Dweck's book, but it also is powerful in relationships too. I think we can model this. It's easy to say I have a growth mindset when I'm in front of my learners and things are evolving with my patients. Sometimes I'm very open saying, here is what I'm thinking, but I'm not quite sure what's happening. So learners can see, okay, he's thinking about it, but I don't know everything, especially some really critically ill patients. Things may be changing rapidly, and me admitting that, hey, there's still some diagnostic dilemma about this patient.
Yeah, let's shift to clinical practice because we all work in really fast-paced environments, whether it's the ICU like Frank you work in and myself, or the ED, which all of us work in to some extent. I would love to know how mindset affects us at the bedside, right? Like whether you're in the recess bay or the ICU. Sometimes I'm in the OR or the cath lab. Would be curious to hear your thoughts about this. Kim, if you want to start.
In the ED, having a fixed mindset can make you freeze up. It can make you stop when you encounter a challenge. It can make you defensive when you get some feedback. A case outcome may not be what we expect or what we want. The tendency is to protect our egos rather than ask, what can I learn? And that's human. And I'm not saying, in the course of this podcast, like this is the right way and we shouldn't have the impulse to do it. You might not be able to help that. That's just cultural conditioning and our experiences up to this point. So the important thing is to use those mindfulness techniques of recognizing it when you hear it and, try and push yourself towards thinking of whatever you're encountering as a challenge and a puzzle you need to solve rather than a threat that's going to cause something bad to happen to you. So a growth mindset clinician, for example, will embrace uncertainty, see mistakes as data points, but this doesn't define me. This isn't my identity. I remember a colleague telling me, you're not defined by your worst shift. And I just think about that all of the time. You are not your worst shift. We can all think of moments when we weren't the ideal physician that we want to be or clinician that we want to be in, and we really messed up. Rather than getting defensive and thinking of it as a scarlet letter, maybe think about what were the factors that led to it. I find it's a really good bellwether too. Usually if I start to feel defensive, it means I've kind of slipped into that fixed mindset and I've got some work to do in terms of the narrative that I'm telling myself.
Absolutely, Kim, too. Just to add some of these, so, yeah, I'll give you something personal as faculty. Again, we don't have it all together. That I was an intern once, and if they saw me as an intern, I think they'd feel a lot better. So admitting mistakes that I've made, I think really helps them as well. Say, oh, okay, my program director has made mistakes in their career. That actually is great modeling, and it just shows vulnerability. I can see sometimes when my learners get a challenging patient and I'm asking, hey, who's going to take this patient? But the thought is, well, I don't want to take this challenging patient, not because they're lazy. I don't think, we're all hard workers. It's because, boy, I may not be able to present this patient well or know all the things going on there. So a growth mindset kind of takes that challenge head on and said, hey, I would like to present this patient. I know I might, make some mistakes in presenting it, but boy, what a challenging patient to really help me grow and learn.
I'd be curious to hear, Frank, how it plays into more team dynamics as well, especially in critical care settings. We often work with more frequent teams, I think, than the emergency department. There's a little less turnover. I'd be curious to hear how it plays a role in critical care and with hierarchy.
Yeah, in critical care, it plays into team dynamics. A growth mindset leader will invite input. What are we missing? It's okay to say that. Anything else? What are we missing? I think sometimes I don't want to stifle my learners because I've said something. They're like, well, he didn't say it, so it might not be there. I could have forgotten something. So I think inviting that, it just fosters collaboration. Fixed mindset leaders rely on hierarchy quite a bit, which silences voices and can literally harm patient because no one wants to speak up or they're afraid to speak up.
Yeah, I love that. I mean, mindset's not just an individual trait. It's a cultural one. And to speak about hierarchy, it's a huge reason why I went into emergency medicine. Leadership matters when there's a critically ill patient because it's all hands on deck. And I've worked under some not so great individuals who hold a leadership position. And I've worked alongside people who would have made phenomenal heads of departments. I mean, all in all, it's the person's behavior, habits, and communication skills that matter more than the title. In fact, we have an excellent blog post called Titles Don't Make Leaders that you should check out if you want more on this particular topic. In fact, I'll share a personal anecdote story. I was on my surgery rotation. I was the medical student scrubbed into a case, and in front of me was this long peanut tool that the surgeon needed. The scrub nurse was talking to the circulating nurse, and I heard him say it once. I quickly grabbed it and handed it to the surgeon, and everybody lost it. Everyone's like, oh, med student's touching the table, the med student's touching the table. And I'm like, oh, it's because you guys weren't paying attention. They're like yelling at me and arguing back. And the surgeon's like, dude, just don't touch the table. And I'm like, oh, this would never happen if this was the emergency department. If a patient coded, I could just yell outside and somebody would run in, and it would be, even if it was, anybody out the door, they would come in and start doing compressions and all hands on deck, like I mentioned. So the hierarchy, like you mentioned, Frank, is something that fixed mindset leaders rely on. And I would highly encourage you to go read that blog post titled Don't Make Leaders.
Oh, that's really cool. I'm going to do that after this.
Yeah, I'll have to check that out. Thanks, Mark.
All right, let's take another angle and talk about overall clinician wellness. How do you both see mindset influencing burnout?
I see a fixed mindset as potentially being a detriment to well-being in medicine. Fixed mindset feeds perfectionism and can lead to a lot of shame. Every mistake feels like proof that you're inadequate when you don't think, not yet, I can't do this yet. You just think, I can't do it. That can be really exhausting and painful, and it's unsustainable in this field when you're going to be seeing so many patients. It is inevitable that you will encounter challenges and have tough shifts. So, without a growth mindset, it can really lead to burnout. And I worry that if we don't help our residents cultivate a growth mindset, that they won't be able to thrive.
Yeah. Yeah, thanks, Karen. I mean, imagine someone with a fixed mindset, which I have sometimes, but always avoiding challenges because they don't want to appear inadequate. I mean, always comparing themselves with others, shying away from unfamiliar things. It's just a lot of weight to carry. Always trying to look good rather than becoming good, trying to look good or trying to look competent rather than becoming competent. It leads to anxiety, it can lead to depression. It leads to what we call the imposter syndrome. And as you got met, it's so much weight to carry to always look good or just always showing people how good I am. It's so much and it can lead to so many detrimental things that I hope our learners can learn from it. And even our faculty members have that same weight on their shoulders. I didn't think we were going to talk about this, but one of the highest rates of suicide are physicians and depression and burnout. I mean, I think this fixed mindset, growth mindset is so important to understand and it can help people so much take all of that weight off their shoulders.
But I think that baseball would, in theory, be a good analogy. We're trying to hit the ball every single time and take great care of every single patient. Any time that doesn't turn out how we planned, it's so hard. And that perfectionism can make us feel such a heavy sense of shame. But I'm really glad that the growth mindset, it feels like a cousin to self-compassion to me. So those are like my armor that I'm going into the ED with. And I feel like it gives me a lot of hope.
Go back to your baseball analogy because, yeah, batting 1,000's perfect, right? If you bat about 300, that means you failed 7 out of 10 times. Like you're going to the Hall of Fame. That's a great batting average in baseball. You just think about that, though.
It's definitely not an excuse to be like callous about when we don't do well, right? This doesn't mean we don't still strive for excellence and that that's not a noble pursuit. But I think it is a testament to how incredible it is what we do taking care of other humans.
Kim, one thing you say when I talk about this, people misinterpret it when you say, oh, it's just about praising people and being positive. That's not what we're going for here. I think we should really set high standards, especially in medicine. And I think the growth mindset is the belief, but the end goal, and we have talked to another podcast, is mastery learning. To become a master learner, you have to adapt that growth mindset. And we want our learners to become, or faculty and myself, I want to grow to be a master clinician, master educator, but that really is adopting the growth mindset belief as opposed to performance-based learning, which is all about showing people what you know rather than growing in your knowledge base so that you can put the most important person, which is the patient, at the center to help them. We could potentially do harm to our patients. So the standard has to be high here. We should shoot for very high standards. I think the way to get there is a growth mindset and mastery learning so that we can give the best benefit to all our patients.
Yeah, Frank, that actually reminds me of one of my absolute favorite lines a mentor told me while I was teaching. He observed me teaching and then said, so gave me some feedback. And the feedback was, do you want to be the sage on the stage or the guide on the side? And I think that is just so powerful, right? Because a lot of people always want to be that sage on the stage that they know everything and they're showing off everything, right? It kind of goes to what I was going to make a comment on about Kim's comment is cognitive onload and cognitive offload. If you're always trying to perform, that is just so cognitively onloading. And that is the opposite of what we're trying to do. You're trying to do less cognitive burden so that you can focus on more important tasks, more meaningful tasks, and more efficient tasks that allow you to better perform. And so it's just so much easier to just let it go and let yourself make those mistakes and offer yourself more of that space and grace to make the mistake and learn from it and understand why you made it and then improve moving forward and then not having to always be performing. Before we wrap up, let's make this even more practical. What are one or two strategies clinicians can use to cultivate a growth mindset starting even today or on their next shift?
Yeah. So here's something really easy that you can implement right away. It's just noticing your self talk. What is the narrative that you're telling yourself when you encounter a challenge? Do you hear yourself saying, "Oh, I suck. I'm bad at this. I'm not any good at this skill," and being really verbally abusive to yourself? Or do you say things like, "not yet," or "how can I overcome this?" Some of those more deliberate thoughts that aren't as reactive and emotional. We all have an inner bully. I know mine is like a little Cartman inside. You wouldn't think about it. Knowing me, everybody kind of jokes like I've probably never said a cuss word. I definitely do in my head. And I really have to kind of tamp that down and change my narrative sometimes. But maybe you can't change the narrative right now, but I think it just starts with noticing. Rob Orman talks about this a lot, and he does a great job unpacking how to improve that inner narrative. I would recommend just talking to yourself like you would a friend. If you told your best friend about that tough shift, they wouldn't be like, "You're right. You're a terrible doctor." Well, if they do say that, they're probably not a very good friend. But, the bottom line is you can, as cheesy as it sounds, be your own best friend. What would your best friend say to you if you started that sort of a narrative? So, anyway, that's what I'm proposing as a little micro skill you can do is just to start noticing that self-talk, that inner monologue. From there, you can start to switch it up and project something a little more positive.
Yeah, that's great, Kim. Second, reframe feedback. Instead of asking, how did I do? If you're a learner or even a faculty member, rather ask, what's one thing I can improve on next time? That keeps you forward looking and curious. I think it's just reframing self talk and then reframing that feedback.
If I can share this, my favorite phrase, which I actually ask learners, is what can I do differently for my next shift? I stole that from someone because I really liked it. But kind of like when you're in a patient room, have you noticed the difference? If you say, "Do you have any questions?" Probably 80% of the time they'll be like, "No, I'm fine." But if you say, "What questions do you have?"
Yeah.
They'll be like, "I actually don't know. Am I supposed to pick up some medicine?" You're like, "That's what we were talking about this whole time." But, it really helps a lot. So I found when I say, "What can I do differently for my next shift?" I almost always get something helpful.
Yeah.
That's really great. I mean, for me, it's modeling vulnerability. As attendings, we share our own mistakes and growth moments, and then we can normalize that process for trainees. That builds a culture where mindset shifts and ripples outward. This has been such a rich conversation. Growth mindset isn't just a buzzword, it's a way of showing up in medicine that shapes how we learn, how we teach, how we practice, and ultimately how we care for patients. Kim and Frank, thank you both for sharing your insights today. To our listeners, the best clinicians are not the ones who never fail or never miss tubes. They're the ones who never stop learning.
Amen.
Amen.
That's it for this episode of Rebel Mind. Subscribe, share, and stay tuned as we dive deeper into practical ways to care for ourselves so we can show up and take care of others.